Hello friends, and welcome to this introductory module about how to prepare for your PGI entrance exam. PGI Chandigarh is one of the mecca of medicine where uh, there is advanced pediatric center, advanced trauma center, advanced center for ophthalmology, advanced center for trauma medicine and emergency medicine. This is the area where you have an opportunity to learn from the masters of medicine. So of course everybody wishes to enter into this such a prestigious institute which has so much of research and your immense amount of opportunity to learn medicine and health. But the only thing that scares many people is how to prepare for PG entrance exam. So here we are, we'll have 10 points about how things are moving in PGI. What are the things you need to remember? Point number one is understand the enemy. So whenever you are at war, you go to any challenge, you face any challenge, it is very important for you to learn about your enemy. So you need to know that PGI is conducted twice a year, in May, June, in summers, and in November, December. The number of seats would slightly vary depending on how many students were enrolled in the previous session or how many seats went vacant. But usually it's around 100 seats, 100 plus seats are there in both the sessions. It is a 3 hour, 180 minutes, 250 questions you're going to tackle in 3 hours, and all this makes a unique feature that all the questions are multiple choices and multiple answers. It is not single best answer. So that makes this PG entrance exam a unique feature. Point number two, let us talk about the PGI entrance exam marking pattern. If you know about the PGI entrance exam, so as you can see on the screen, let us say there is a question A, question 1, which has option A, B, C, D and E. There are 5 options in the entrance exam, every question. So let us say that in reality, there were these 2 options which were right. Okay, so in totality, there are 250 MCQs in the entrance exam. Each MCQ has 5 options. That gives us 1250 options to study. So in any typical type of PGI entrance exam, it is usually said, of course it will vary every time, it is not a standard notion, but it is usually said that roughly around 600 to 650, usually on the higher side, they are the correct options, and on the lesser side, usually around 550 to 600, these are the wrong options. Of course this can vary depending on the difficulty level of the exam, but usually it is said 650 to 600 MCQs options are the right options. So now, how is the PGI scoring done? PGI scoring is done on the basis of the number of right answers which are marked correctly by the student. Let me call that as X, divided by the total right in the exam, total right options. Let us say the total correct options were 650, let me call them as A. So this is X divided by A, minus the total wrong options which were marked wrongly by the student, let me call that as Y, divided by, these were the wrong options which were marked wrongly by the student, divided by the total wrong. Total wrong, let me call them as B. So Y divided by B into 100, taking the percentage. This gives us the percentage scored by the student in the PG entrance exam. So it's a kind of tricky understanding or marking of the understanding of the marking, and you need to know it before you attempt the entrance exam. So it is the total right options that you're going to mark divided by the total correct minus total wrong that you will mark divided by the total wrong. Now, I have something more important to tell over this. Just look at this diagram. Just look at this diagram. This is a scatter plot that I have prepared from how the students were marking in our grand test or mock test, PGI based mock test, which we are doing since last 4-5 years. So I have gathered all the data from the students in every exam, and this is what this data was showing. So on your screen, see, in this I want to show you that the green colored shaded areas, this area, the green shaded area, is where maximum number of students would lie. On the horizontal axis, you have the right answers marked, and on the vertical axis, these are the wrong answers marked. What I want to say is that usually a typical student, MBBS graduate student who is aspiring for PGI entrance exam would usually mark roughly around 600 to 700 options. Out of these 600 to 700 options, it is usually seen that 400 options are the correct answers which the student will mark, and roughly around 200 or 200 plus will be the incorrect options. These will be the incorrect options. So what is the percentage which an average student will get? Try understanding that if they are marking 400 plus options, 400 450 options as correct, so let me take 400 divided by, let us assume 650 were the correct, minus 200 divided by, let us assume 600 were the incorrect, multiplied by 100, this will roughly give you any percentage, roughly around 30 percentage. It is usually seen, please try to understand, it is usually seen that a PGI aspirant, usually average student, is scoring around this much. Now I want you to understand that you have two options. Either you tend to increase this number or you tend to decrease this number. That is the only way you are going to score better. In nutshell, you need to mark something around 600 plus options. If you mark 600 less options, you will always stay at this percentage. Now, take home message is that you have two options, either to increase your right answers or to decrease the wrong options. I would always suggest you that you mark around 650 700 options. Out of them, obviously it depends on the difficulty of the exam also. Out of them, always keep your hand restrained. Don't mark too many, because the more you mark, the more wrong options you are tend to getting. So if I see a question, I know that this is the right answer, I will definitely go and mark it. But if I try to mark just for the sake of marking, because somebody told that mark 650 options, for the sake of marking I am marking 650 options, that is a very wrong way. Try to stop your hand, restrain from marking until unless you don't know that is the right answer. That is the summary I want to share with you. Third point number 3, that time is a very precious rank. So in PGI entrance exam, it is the time which matters the maximum. Most of the time, maximum, in my last 10-11 years of experience, whatever the students have come out and said me is that, sir, in last 20 minutes or 30 minutes I did not even see the last 50 questions. That is the most common answer which every student comes out and tells us. So please remember that time is a very crucial thing. See, there are 250 questions into 5 options, that brings out 1250 options. So you have how many minutes? You have 180 minutes, you have 3 hours, 180 minutes. So 180 minutes to solve 250 MCQs. That comes out to be how much? That comes out to be roughly, if you get your mathematics right, it comes out to be roughly 45 seconds per MCQ. So of course this is a major problem. It is a problem that how you're going to tackle each MCQ in less than a minute. The only way to answer is practice and practice and practice. I always say to students that for PGI entrance exam, if you are not solving 10 to 15 mock tests, PGI based mock tests before the entrance exam, you are doing a big blunder. Studying theory is one thing, but solving the real exam is another thing. So you need to solve the exam to solve the final exam, because practice is what is going to make you much better and save your time in the exam. Mind you, remember my word, time is rank in PGI. You are in time, you will definitely score good, much better than what others will score. So to gain more time, you need to practice more. So that is what is important. Point number 4, subject weighted. Let us talk briefly about what are the subjects you are going to see in PGI entrance exam. So let us talk briefly about a few subjects that you're going to see in PGI entrance exam. So here you have on the screen some of the subjects that you can see. If you mark these subjects, let us get it together, biochemistry and molecular biology. In totality, you can see there are 17 questions. So what are my most weighted subjects in PGI entrance exam? All said and done, without saying also, you should be knowing that medicine and surgery are one of the most sought after subjects. They are very important in PGI Chandigarh, right? Because you can see that 32 questions and 23, you can see roughly around 50 questions are only from medicine surgery. Apart from this, please remember, do not forget pathology, which is very important. Pharmacology, another important. Microbiology, another important. And community medicine, another important is obs and gynae. So these are your 7-8 subjects which carry the maximum weightage. You cannot afford to lose them. You cannot afford to not study them and go for the entrance exam. It is not possible, it is not advisable, and not good for you. These subjects will carry maximum weightage. Next point. Point number 5 is there are something known as these subjects which are the VIP subjects. So why do I call them as VIP subjects? VIP, they are our precious subjects. I keep them close to my heart. What I mean to say is that subjects like ENT, subjects like ophthalmology, subject like microbiology, subject like forensic medicine, subject like orthopedics, and of course one of the big subject is biochemistry and molecular biology. If you are understanding, these are the rank deciding subjects. There is something known as maximum weightage we just saw about obs and gynae, about medicine surgery, but there are some set of students who actually cleared the exam and another set of students who unfortunately could not clear the exam. What is the difference between the marking pattern? Again, I studied this marking pattern. What makes a student as topper? Was it more knowledge about medicine surgery? Of course not. It was the more knowledge of these 5-6 subjects which was actually deciding the ranks. The number of biochemistry questions which a topper will mark and number of biochemistry questions which an average student will mark was too much varying. Mind you, the delta difference was very high in biochemistry, in ophthalmology, ENT, in forensic medicine, of microbiology. All these subjects did carry a rank deciding property, that the more you marked from these subjects, the more chances were that you would score better in PGI entrance exam. So that's the reason I call them as VIP subjects. Next point, I would also like to talk about the subject material or the resources that you have. If you talk about the subject materials or the resources, please mind you that for most of the subjects like pharmacology, I would recommend you to follow Lippincott's. It is one of the most contained, most concise and best book. For biochemistry, again, Lippincott's is one of the best thing. For pathology, nothing much better than Robbins, because these are standard textbooks which are of course going to give you a very high yield subjects. These are high yield subjects, right? Apart from this, medicine surgery is always there which you need to do, and I would always recommend 7 years, last 7 year MCQs rather than 5-year MCQs to be revised. So how to revise them? You take out any year MCQ, you take out 2014 MCQ, 2017 MCQ, 18 MCQs, and you take them one by one. First MCQ was from glaucoma, second MCQ was from retinopathy, third question was from some criminal act. So in these questions, you take these questions, study it from the reference book, and you prepare it. Very important is, once you prepare the high yield subjects, high yield topics are to be prepared from these MCQ exams. Once you prepare them, always remember that you need to mark 18 to 20 points per topic. That if you take retinopathy, you try to find out 20 points which can be asked in the exam, and you write them on a register or a copy page. Next is, you take up glaucoma, write down 20 points on glaucoma. In this manner, you will be able to finish the whole topic in totality. Please remember, there are big books on glaucoma. At this level, at PGI entrance exam, at PG entrance exam, post MBBS, you are not supposed to study everything about retina. You're not supposed to study everything about glaucoma. Glaucoma, there is super speciality in glaucoma. There is no limit of education, no limit of knowledge. but at this level you need to write down 20 points. If you write down more than 30 points, you'll not be able to retain at the end of the day. If you write down less than 15-16 points, they are very less. So that is what I have summarized, that 20 points per topic is one of the ideal points that will help you for your entrance exam. Next point is, don't be greedy. You can do anything in life, but you cannot do everything in life. Don't try to study, I'll study from book A, from book B, book C. That's a very bad habit. Don't study from different sources. Take one book, study it 5 times rather than studying 5 books and studying them one time, right? So manage your resources, keep yourself focused and contained. Take any book, trust it, and do it till the end. You need to solve all the 5-7 year MCQs, and you need to do these topics in detail from reference books, the high yield topics which you have prepared. So you trust any book and you try to do it 5 to 6 times. That is the only and the best way for cracking the PGI entrance exam. Next, you should also have it in mind that there is no second chance, especially in exams like PGI Chandigarh. There is not a second opportunity that we get very often. What happens in PGI entrance exams is, or exams like Central Institute exams, is that your level of knowledge will keep on decreasing every month or every year. So if a student is there who has scored, let us say, rank number 80 this year, it is not guaranteed that next year he or she will score lesser than 80 rank. There are very high chances that the student might score something not good, or maybe 100 rank or 200 rank. So the rank is not dependent on actually how much effort you have put in. So this year, whatever time you have 4 months, let us say now it is January, so it is February, March, April, May. You have this much time. So you focus your time, you manage your time accordingly, and you strike it hard and strike it gold. So don't waste your time. Whatever time you have, you just put your best efforts and strike it once and for all. Because usually in central exams, there is no second chance. Either you make it or you break it. That's how it happens, right? So just think that there is no second chance, in the sense that it is not guaranteed that if this time you are getting, let us say, 500 rank, so next time again you will attempt and you'll get 200 rank. So keep this in mind. Moving forward, I would also like to stress upon that whenever we are preparing for an exam, it is always good to plan, because any goal you have which is without a plan, it is just a desire, it is just a wish. So you need to plan accordingly. What I want to say is that, let us say today it is January. So Jan, Feb, March, April, you make some macro plan that this is what I will do in January month. This is what I will do in February month. This is what I will do in March and April. These are my macro plans. In April, I will finish off everything and I have to revise everything. So that means you have 3 months in hand. Now you divide your subjects in weeks and then you plan accordingly. Paste that schedule on your study table, or share it with someone, because once you share it with someone, they will give you an external motivation all the time. Or if you paste it on a wall, you are seeing it every time, and there is an external feeling of motivation every time that you need to achieve this goal, right? So always remember that you need to share it or open it publicly. That will always help you in achieving the goal in reality. Last point is, because you are preparing for PGI entrance exam, it's a tough exam, you need to be very much determined, and of course if you are doing it in a very strategic manner, it will be very helpful for you. So please remember that if you're thinking of PGI, think of PGI. Every cell in your body should be motivated enough to talk of PGI entrance exams and to finish off this PGI hurdle very soon. See, what is the difference between you and the PGI entrance exam? It is just a river made up of 250 MCQs. You need to cross that river. So it's pretty simple. You learn how to think of PGI. You learn how to think from the examiner's point of view, and that is the only way that you can make questions and solve questions. With that, I would like to wish you all the very best, and any doubts or any questions you have, you're most welcome to post it on our helplines or post it on the social medias, and we'll be happy to help you. Thank you so much. Best wishes for your PGI entrance exam.